Hello future nurses, confused about electrolyte imbalances? In this video, let's make magnesium imbalances, that is hypomagnesemia and hypermagnesemia clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Magnesium. The normal level of magnesium is 1.8 to 2.6 milliequivalent per liter. Magnesium is essential for muscle contractions, nerve conduction, enzyme activity, and cardiac rhythm. To remember this, we know that symbol of magnesium is Mg. So we can remember Mg as muscle governor. Now it is easy to remember the function of magnesium. That is, magnesium governs the muscle, means it is essential for muscle contraction and also for nerve conduction and cardiac rhythm. Now, the normal level is 1.8 to 2.6 milliequivalent per liter. So, two conditions occur when magnesium is out of balance, either hypomagnesemia or hypermagnesemia. In this video, let's discuss hypomagnesemia. Hypomagnesemia. Serum magnesium level less than 1.8 milliequivalent per liter. Hypomagnesemia is a condition in which serum magnesium level is below 1.8 milliequivalent per liter. Let's discuss the causes for hypomagnesemia. And the hypomagnesemia is a condition in which there is low magnesium. So to remember the causes, we have a mnemonic that is low mag. That is, because of these conditions or because of these causes, there is low magnesium in the body. L. L stands for low intake, malnutrition, alcoholism, or starvation. If there is poor dietary intake of magnesium, that can result in the overall low magnesium levels in the body. O. O stands for other losses like GI loss due to diarrhea from fistula or nasogastric tube suction. So these losses like vomiting or suctioning can also cause loss of magnesium from the body. W, that stands for wasted in urine, diuretics, aminoglycosides, or cisplatin. Uh, as we know that kidneys are essential for magnesium absorption, reabsorption. So if the person is taking diuretics, then also magnesium reabsorption from kidneys can be impaired. So more magnesium can be excreted in the urine, resulting in low magnesium in the body. And also aminoglycoside antibiotics and cisplatin is a chemotherapy drug. Both these both these drugs also damage the renal tubules. So if renal tubules are damaged, then also the magnesium reabsorption can be impaired, due to which there is a resultant low magnesium in the body. M stands for malabsorption, like Crohn's and celiac disease. These are the malabsorption syndromes, Crohn's disease and celiac disease. If the person or the client is having any of these malabsorption disorder, then the absorption of magnesium in the GI tract is impaired. So if less magnesium is absorbed, the result is hypomagnesemia. A stands for alcoholism. Alcoholism is the commonest cause for low magnesium because alcoholism reduces absorption of magnesium and also increases renal excretion of magnesium. So the result is low magnesium in the body. G stands for glycemic issues like hyperglycemia or insulin administration. We know that in condition of hyperglycemia, that is a diabetic condition. In case of diabetes, the three P's as sign and symptoms are observed, that is polydipsia, polyuria, and polyphagia. So polyuria, that is increased urination, and when there is increased urination, so the ions or the electrolytes are not reabsorbed in the kidneys. So similarly, the magnesium is also not reabsorbed in the kidneys when there is any glycemic issue, due to which the condition of hypomagnesemia occurs. So these are the causes for hypomagnesemia that includes low intake, other losses like GI loss or wasted in urine, malabsorption syndromes, alcoholism or glycemic issues like hyperglycemia or due to insulin administration. The clinical manifestations for hypomagnesemia. Let's discuss the signs and symptoms that appear due to the condition of hypomagnesemia. We know that magnesium was essential for muscle contraction because it is a muscle governor. So, to remember the clinical manifestations, we can remember the mnemonic twitching, where T stands for tachycardia or tetany. We know that magnesium was essential for nerve and muscle contractions. So, if there is low magnesium, the nerve and muscle excitability increases, which causes muscle contractions and tremors, cramps, that is tetany, are also tachycardia because of fast heart rate. W stands for weakness. Muscle cells cannot contract properly if there is low magnesium in the body because energy imbalance also occurs. So, muscle weakness. I stands for irritability. CNS symptoms occurs due to low magnesium, like irritability, restlessness, or also person can have trouble sleeping. T stands for twitches. We already discussed muscle twitches can occur, muscle cramps. See, conversions, confusion, changes in ECG. Conversions and confusions occur due to because of CNS hyperexcitability, and ECG changes will also occur. Abnormal heart rhythm uh, occurs due to impaired cardiocontractility, means the muscles of heart cannot contract properly, due to which there are abnormal ECG pattern. H stands for hypertension or hyperreflexia. Hypertension or hyperreflexia can occur. I. Involuntary movements like seizures. Involuntary movements will also occur because a low magnesium will also affect brain and nerve stability, which causes involuntary jerky movements that are known as seizures. N stands for nausea and vomiting. Nausea and vomiting occurs because GI smooth muscles function and coordination contraction will be impaired. So nausea and vomiting can occur. Other GI issues may sorry other GI issues like diarrhea, abdominal distension, anorexia can also occur due to hypomagnesemia. So these are the clinical manifestations of hypomagnesemia: tachycardia, tetany, weakness, irritability, twitches, convergence, confusion or changes in ECG, hypertension and hyperreflexia, involuntary movements like seizures, nausea and vomiting, and GI issue. Let's discuss the ECG changes for hypomagnesemia. ECG changes include tall T wave and depressed ST segment. These are the ECG changes that occurs in a condition of hypomagnesemia, that is tall T wave and depressed ST segment. This is a normal ECG pattern, as we can see the P wave, the QRS complex, T wave, PR interval, QT interval, and also we can see the ST segment, which is means this is a normal ECG pattern, and this is the ECG pattern of hypomagnesemia. As we can compare it with the normal ECG pattern, we can see the tall T wave and also the ST segment depression. We can see the ST segment is depressed in case of hypomagnesemia. So these two ECG changes occur, that is tall T wave and depressed ST segment. Let's discuss the management of hypomagnesemia. How we will manage the condition of hypomagnesemia. The mnemonic for management is fixed mag. That is, we have to fix the magnesium level. F stands for foods high in magnesium. We can encourage the client to take foods that are rich in magnesium, including nuts, green leafy vegetables, whole grains, or fish. I stands for IV magnesium sulfate. If it is a severe case of low magnesium, means the magnesium is very low, then we can go for IV magnesium sulfate. But if it is not a severe case, then we can also give oral magnesium supplements to the client. X. Examine potassium and calcium levels. These are often low if there is low magnesium. So we have to monitor for potassium and calcium level whenever we are correcting or we are managing a condition of hypomagnesemia. M stands for monitor reflexes, cardiac rhythm, urine output. We have to monitor the person for reflexes, cardiac rhythm, because there are mainly two ECG changes that occur because of the abnormal cardiac rhythm and urine output. A stands for assess for cause and arrange seizure precautions. We have to assess and identify what is the cause, and we have to treat the underlying cause for hypomagnesemia and arrange seizure precautions because seizures occur in condition of low magnesemia, so we can initiate fall precautions for the client. G stands for GI tolerance. Oral magnesium may cause diarrhea. If we are giving oral magnesium supplements, so that can cause diarrhea, and diarrhea is a sign of poor tolerance, from where we can note that the person is having poor tolerance of oral magnesium. So we can go for IV magnesium if the person is not tolerating oral magnesium properly. So these are the management for hypomagnesemia, which we can remember from the mnemonic fixed mag. Food high in magnesium, IV magnesium sulfate, examine potassium and calcium levels, monitor reflexes, cardiac rhythm, and urine output, assess for cause and arrange seizure precautions, GI tolerance. If oral magnesium may cause diarrhea, so if the person is not tolerating oral magnesium, then we can go for the other options. So, this is the condition of hypomagnesemia, including the causes of hypomagnesemia, the clinical manifestations, including the ECG changes that occur, and the management of hypomagnesemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.